Hello, my name is Leslie Rogers and I'm a student physical therapist assistant at Jeff State. Today I'm going to be presenting a case study. My patient is a 48-year-old male that was referred by his MD to physical therapy for acute right tennis elbow. Tennis elbow, or lateral epicondylitis, is an inflammation of the tendons that attach the forearm muscles to the rounded projection of bone on the outside or lateral aspect of the elbow called the lateral epicondyle. The forearm muscles and tendons become damaged from overuse and repetitive motion. This leads to pain and tenderness on the outside of the elbow. Pain may also radiate into the forearm and into the wrist. There can be muscle weakness in the forearm, wrist, and hand. Tasks may become difficult, such as gripping, twisting, or carrying objects with your hand. My patient is an engineer and he is right-hand dominant. He plays tennis and his symptoms began about 2 weeks ago after he played in a tennis tournament. He noticed increasing soreness throughout the 4-day tournament. His symptoms decreased with rest but flared back up again after playing tennis 2 days ago. My patient's past medical history includes hypertension and he takes Dapro, which is a non-steroidal anti-inflammatory drug or an NSAID that is used to relieve the inflammation, swelling, stiffness, and joint pain that is associated with osteoarthritis and rheumatoid arthritis. 2 subjective findings that I reassessed each session for my patient included the patient's pain level and also what activities or movements brought about his pain. 2 objective findings I reassessed each session for my patient included the patient's strength and his pain level with his range of motion, both active and passive. A soft tissue mobilization that I chose for my patient following the initial evaluation was transverse friction to the common extensor tendon. I did this for 3 sets of 30 seconds with a 1-minute rest in between each set. As healing and pain relief progressed with therapy, I increased it to 3 sets of 2 minutes with a 30-second break in between each set. Okay, so the soft tissue mobilization that I chose is transverse friction. So on a scale of 0 to 10, 0 being no pain and 10 being the worst, how would you rate your pain today? 6. All right, well, this is not going to be very comfortable. It might be painful, but we don't want it to be too painful, okay? If it is, you just let me know and I'll ease up on the pressure. What this is going to do is going to help loosen the tendon sheath. It's going to help break up adhesions. It's also going to increase the blood flow to facilitate the healing of the tendon. It will promote the formation and properly align the tissue, and it'll increase the tissue extensibility and mobility. All that means is we're going to loosen up the tendon. It's going to help decrease your pain and help with your motion. Okay? All right. Do you have any questions about this before we start?
No.
All right. I'm not going to use lotion because I really want to get some good friction. So we're going to find his lateral epicondyle. All right. We're just going to do some friction here. How's that feel?
Good.
Okay. Going to do this for 30 seconds. We're going to do 3 sets of that. We're going to take a 1-minute break in between. An objective finding related to choosing the transverse friction technique is that there was tenderness to palpation of the common wrist extensor tendons with moderate pressure. There is also pain with active range of motion of wrist extension and passive range of motion of wrist flexion. A home exercise that I chose for my patient following the initial evaluation is stretching the wrist extensors. I chose this because it will increase the tissue flexibility to decrease pain and to decrease the range of motion impairments. Alright, so now I'm going to show you an exercise that you can do at home. All you're going to do is hold your arm out straight in front of you like this, and you're just going to pull your hand back like this, okay? We want to hold that for 15 seconds, and then you can relax, and we're going to do that 3 times, okay? You can do that twice a day and 3 times per week. Do you have any questions about that?
No.
Okay. You want to make sure your elbow stays straight, and it's going to be slow and gentle, okay? You don't want pain. If you feel pain, you need to decrease the amount of pressure you apply, okay? If the pain is intense, you need to stop the stretch immediately, okay? It should be felt in the forearm, but it shouldn't be felt in the elbow or the wrist. If you feel it there, you might be doing it wrong. You could try to readjust. If you still continue to feel it there, just don't do it at all, okay? And you make sure you're keeping a good straight back when you do it, and just breathe normally throughout.
Okay.
Any questions?
No.
All right, so show me one more time. And just pull it really slow. Good. All right. An objective finding related to choosing this home exercise is active range of motion of left wrist flexion 0 to 90 degrees, but right wrist flexion is 0 to 80 degrees. Also, passive range of motion of right wrist flexion is 0 to 90 degrees, but with pain. One patient education activity that I addressed with my patient following his reevaluation was tennis modifications. I explained to him that we want to use some different techniques to minimize the chances of pain and re-injury. He should use a lighter weight tennis racket so it doesn't put as much stress on his elbow. He should also use a larger racket grip, which will help ease the stress of his wrist extensors. He should loosen his tension on his racket strings to help absorb the impact of the ball and to reduce the impact radiating up his arm. He should use a two-hand backstroke to take the stress off his right arm. He should also wear a tennis elbow strap. The tennis elbow strap redirects the stressful forces away from the injured area. It also changes the angle at which the tendon works at the elbow, which changes the forces that are applied to the tendon attachment, allowing the injured area time to recover. We also want to avoid serving during the healing process. All of these things are important because he wants to begin playing tennis again, and we want to do all we can to prevent pain and re-injury so that he can play. The prognosis for my patient looks good. Based on his reevaluation, he shows improvement with decreased pain with palpation and range of motion. He also has increased strength with wrist extension and with dynamometry. There is still pain with overuse and repetitive motions, such as writing and drawing longer than 45 minutes and repetitive dynamometry for 2 minutes. I think that with continued therapy and activity modifications, he will be able to eventually return to his previous level of functioning. Some activity modifications and assistive devices that will help my patient would be the tennis elbow strap. He can wear that when performing any activity that may produce pain. It is important to avoid all aggravating activities such as strong and repetitive gripping. Also, with writing and drawing, he should take rest breaks before the pain starts. I suggested every 15 to 20 minutes would be a good time to take a break, even if it's only for a few minutes. As far as tennis playing, it is important to remember all the tennis racket modifications and the particular techniques we discussed to help protect the area, such as the two-hand backstroke. As far as the estimated time for my patient to return to function, the reevaluation puts the patient receiving physical therapy for 4 more weeks. I think that by strictly following all activity modifications, avoiding aggravation, and continuing to work on strengthening and pain relief, the patient should be able to return to functioning following this 4-week period. Thank you.